Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
And getting together with our friends from the Healthcare Clinic here in Austin, Dr. David Struble and Lee Acey joining us to talk today about the Healthcare Clinic. Gentlemen, good morning to you.
Good morning. Thanks, John. Hi.
Always interesting to talk about the Healthcare Clinic, and we're going to kind of transition a little bit and talk about some more specific things that are included in a membership in the Healthcare Clinic. And I was reading the article, and I would encourage people to go to your website. It's absolutely fascinating. We're going to talk about having your liver scanned and being part of the your membership, and why this is such a great tool, and it's, if I understand correctly, a very non-invasive procedure.
That is right. This is a fairly new technology. It is ultrasound-based, and it's most people are used to ultrasounds as ways of looking at what an organ or a body part looks like with sound waves. Ultrasound is basically like sonar. You throw sound waves in, and then you watch how they bounce back off of stuff, and the way they bounce back tells you something about what the stuff they're bouncing back off of. This one uses that kind of ultrasound technology, but it's not to look at the liver. It's actually to measure things about it. So it basically throws an ultrasound wave into the liver and essentially shakes it with that. Now, you don't feel that, so it's not, doesn't feel funny, but basically shakes it at a high frequency, and then it measures how much of that wave is reflected back and how much isn't, and then it has complicated computer software in it that gives an estimate of how much fat is in the liver and how much scar tissue is in the liver. And one of the things we're seeing a lot lately is what's called non-alcoholic fatty liver disease, or NAFLD. NAFLD is, if you want to just say it that way. And this goes along with the metabolic syndrome and the high carbohydrate diet that we see in the United States. And we're seeing a lot of this. As the liver gets more fat in it, some people will develop actual inflammation in the liver as a result of that fat. And when there's inflammation in the liver, that is generically called hepatitis. Now, everybody freaks out when you say that. They think you mean an infection or something. And that is one of the causes of hepatitis, an inflamed liver, but there's a lot of other causes as well. So this is one of them, and the fatty liver disease in some people produces inflammation, and that is demonstrated usually by a blood test that shows that their liver enzymes are elevated. And so then the liver enzymes are elevated, and then we say, okay, well, there's some hepatitis present. There's some inflammation in the liver. And most of the time, that's just due to this fatty liver disease. Now, when it is the hepatitis, and not just the fat present, but there's actually inflammation as a result, then the name of that is a little bit different. It sounds a lot the same. That one is non-alcoholic steatohepatitis. Steato means fat, and hepatitis means an inflamed liver. And non-alcoholic, this means that alcohol isn't probably the cause. And most of the time, you can tell sort of that it's a non-alcoholic cause by the pattern of the liver enzymes. Alcoholic liver disease has a little different pattern in most cases. So this condition is called NASH. And anytime there's inflammation in the liver, hepatitis from any cause, the liver will heal from that, but it will heal with scarring. And if there's enough scarring, now the liver starts getting stiff and it stops working properly. And if the scarring is bad enough, then we call that cirrhosis. So this condition, this NASH, is going to become, or already is actually, the number one cause of cirrhosis in the United States.
And the importance, and we were kind of getting that. Obviously, the liver kind of acts as the ultimate filter of everything going on in your body outside of maybe what the heart does. But the liver is very important to just on a day-to-day. Is it something that once it's diagnosed, are there things then that people would look at to improve the condition or stop the deterioration? Or kind of what, once we get diagnosed there, what's the path then?
Right, absolutely. The cirrhosis is just really bad and exuberant scarring. So it's advanced scarring in the liver. And even cirrhosis is divided into several different levels. And early level cirrhosis can be managed quite nicely generally, and it may not even change somebody's life expectancy. So even with advanced liver disease, in some cases, there are things that can be done. But our goal is actually to find this when there's either just fatty liver disease, which is very reversible, or when there's earlier scarring, which can be stopped so that it doesn't progress on to severe disease. So there's a long period of time where changes can be made, either lifestyle changes, which are the most important ones, or medications, which sometimes are helpful. Those can be used early on and can either reverse, in many cases, or slow down or stop progression. And that duration of time is quite long.
It's one of those things where knowledge is power, and being able to have that scan done, I think, would give people comfort in knowing where they're at, and being able to catch it early, as you said, is probably very important in continuing a healthy lifestyle.
That is exactly true.
Yeah, and that's why we were so excited to have this opportunity to be able to include this technology in the healthcare clinic, package of benefits that are offered to members. We're also including it for people who aren't yet members, or they haven't decided to become members. If they want to get it, they can purchase that separately. But it's, we think it's a really important thing, especially with the increasing prevalence of diabetes and obesity and other related things to metabolic syndrome that really are strong indications that fatty liver is likely there.
And we talk about restoring the soul of healthcare, and we're not just talking about your if you will, Andy Griffith type Mayberry visit with the doctors. At the same time as being very personal, you're on the cutting edge of some of these technologies, because if I understand right, the healthcare clinic is the first primary care clinic in Minnesota to offer this?
That's correct. Yeah, so this is the only primary care clinic in Minnesota that is offering this. And so, we talked a little earlier on about, we want to be Norman Rockwell meets the Jetsons, and this is a little bit of the Jetsons thing. This is some technology that's really helpful and can help us be able to, help Dr. Strobel be able to, assess the health of the liver and then give good guidance in terms of what somebody might do to stop the progression or maybe even reverse it.
Yeah.
And something you can do right there.
Yes.
Yeah, exactly. They don't have to. I mean, it's about a 10 or 15 minute procedure typically for the scan. I've had it done. Three of our three nurses practiced on me, and I can just say, other than my being the fact that I took 45 minutes with my arm over my head and I got a little stiff shoulder out of it. For somebody who's just having one scan, it's very painless and really not difficult at all.
And we're looking forward also to having this technology available for folks that maybe aren't interested in a healthcare clinic membership, but their doctor would like to know something about their liver health, the fat in the liver, the scar in the liver. There are reasons to do that, and yet they don't want to be a member, and so this makes really quite an inexpensive test available, at least as a screen for this condition. There are better tests that can be done, and by better, what I mean is not just better in every way, but tests that give more specific and exact results. that you can do. An MRI scan can be done, for example, that gives a much clearer and easier result and has a lower chance of failing. The FibroScan is a little bit user sensitive, so that it requires practice, and some people don't do very well with the scan. We just don't get a very good image. So then we would just say, well, but that's not the way to do it. So the MRI scan makes a little more reliable that you're going to get a good result, but it's also much, much more expensive. Mm-hmm. And so then this makes an inexpensive technology, or relatively inexpensive, available to people rather than always having to use the much more expensive technology in order to diagnose this.
Unfortunately, we always run ourselves way out of time here on our Thursday get-together. If people want more information or to learn more about the Healthcare Clinic, Lee, what could they do?
Yeah, they can give us a call at 279-2345 or stop in at 308 4th Avenue Northwest. It's right between the Hormel Historic Home and St. Augustine's. Or stop in Monday through Friday or Saturday mornings, and we'd be glad to show them around and tell them and show them what we have with the FibroScan as well.
Yeah, as they say, knowledge is power. So check out the Healthcare Clinic and get as much information as you can. And who knows, maybe membership is the right thing for you. Find out more by checking out their website or stopping in. Dr. Strobel, Lee Acey, appreciate the information. Look forward to our next conversation next Thursday.
Okay, very good. Thank you, John.
Right.
Have a blessed day.
Have a great weekend and happy Easter, both of you.
Thank you. You also.
Thank you.